Everything fine. You can go ahead.
Okay, okay. Thank you so much, sir. Sorry for the inconvenience. Good evening to all the respected members of IFPH Forum. I warmly welcome you all for the today's webinar, which is organized by IFPH Forum. Myself, Dr. AMRUTA ANIL HON. Today, I will be speaking on the topic that is adenoids and its hypertrophy with homeopathic management. The reason for what I have selected this topic because adenoid hypertrophy is most common condition commonly seen in children associated with mouth breathing, snoring, recurrent cough and cold, and various types of ear infections. In many cases, surgery is indicated if the symptoms get worse. In such type of cases, our homeopathic medicines they act like a miracles to get the symptoms which the child is suffering from. So in today's webinar, we will discuss about first anatomy of adenoids, then what are the causes and clinical features of adenoids, then diagnosis and investigations which are used in case of adenoids and along with its complications, and also homeopathic approach towards the adenoids. So let us begin this journey of a knowledge of adenoids with this enlightening session, which is given by IFPH Forum. Now we will discuss first about what is the anatomy of adenoids. Okay, adenoids they are also called as nasopharyngeal tonsils. Okay, these adenoids are hypertrophied mass of lymphoid tissue which are situated at the junction of the roof and posterior wall of nasopharynx. So the exact anatomical location of adenoids is they are always situated into the posterior wall of nasopharynx. Then these are the mass of lymphoid tissue which is termed as adenoids only when it is hypertrophy. Okay, when this lymphoid tissue get hypertrophy, we call it as adenoids. Okay, it usually undergoes atrophy by the age of puberty, that is at the age of 13 to 14 years. This is the exact location of adenoids. They are situated into the posterior wall of nasopharynx. Then what are the clinical features what are the physiological look of this adenoids? They are in pink in color with the globular mass with vertical ridges on its surface with no crepes, and they are also lined by ciliated columnar epithelium with no capsule at all. Okay, I will again repeat. These adenoids, they are pink in color with a globular mass with vertical ridges on its surface with no crepes, and they are lined by ciliated columnar epithelium. Then the blood supplies, they are supplied by ascending palatine branch of facial artery, then ascending pharyngeal artery, then also they are supplied by pharyngeal branch of third part of maxillary artery. Okay, I will again repeat. Adenoids, they are mainly supplied by ascending palatine branch of facial artery. So facial artery is the main blood supply for these adenoids. Then it is also supplied by ascending pharyngeal artery, then pharyngeal branch of third part of maxillary artery. Then lymphatic drainage. Lymphatic drainage is mainly through upper deep jugular nodes, retropharyngeal nodes, and also by parapharyngeal nodes. Okay. Then we will discuss about what is the X-ray or radiological view of adenoids. This is a normal nasopharynx, and these are enlarged adenoids or hypertrophied adenoids. Then what are the common causes behind enlargement of these adenoids? So first and foremost important cause is hereditary, then excessive cold climate, then specific infection like tuberculosis, most commonly seen in tuberculosis. Then also it is most commonly seen in physiological hypertrophy, may be seen at the age of 3 to 10 years. Okay, I will again repeat: hereditary, cold climate, specific infection like tuberculosis, physiological hypertrophy may be seen up to the 3 to 10 years. Then what are the symptoms in which there is adenoid hypertrophy, or when the child is suffering from adenoid hypertrophy or adenoids, what are the symptoms, local symptoms as well as general symptoms? First of all, local symptoms, they include bilateral nasal obstruction, then snoring, mouth breathing, rhinorrhea pleusa, frequent rhinorrhea, epistaxis, then feeding problems, especially in children, then conductive deafness due to eustachian tube blockage, then various cervical lymphadenopathy, otitis media, adenoids, facies, then bronchitis. Then adenoid faces, these are sunken eyes. See, the look of this child is, his eyes, they are sunken. Then narrow pinch nostrils, then open mouth. See, the child has this open mouth, then high arch palate, crowded teeth, dull mask like dull face, protruding teeth, dribbling of saliva, then everted upper lip, rhinorrhea, and loss of nasolabial folds. Okay, these are the common symptoms or common symptoms or common complaints the child is suffering from. Now, up till we have discussed about what is the anatomy, blood supply, nerve supply, and lymphatic drainage of adenoids. Now we will discuss what are the oral manifestations of this adenoid. They include otalgia, otitis media, acute otitis media, then atelectasis, otitis media, then eustachian tube block, chronic otitis media. Then diagnosis is confirmed by nasal obstruction, that is rhinorrhea, pink globular mass with vertical ridges, bilateral retracted eardrums. X-ray shows lateral view of soft tissue mass. Then, if we want to differentiate diagnosis of adenoids, they are towards the cyst. This is a benign rare developmental cyst, and also what are the various complications like otitis media with effusion, recurrent otitis media, rhinorrhea, chronic sinusitis, sleep apnea syndrome, and decreased physical and mental development. Okay. Up till now, we have discussed about what is the anatomy of adenoids, what are its lymphatic drainage complications. Now it's time to discuss about what is the exact homeopathic approach towards the adenoids. See, in homeopathy, we consider patient as a whole, not his disease part or not his disease adenoids or not his hypertrophies adenoids. So in homeopathy, we treat adenoids constitutionally and symptomatically, mainly focusing upon the individual child's total symptoms rather than enlarged tissues. In homeopathy, we consider patient as a whole, not his enlarged adenoid or hypertrophied gland. So if we want to give a constitutional treatment which is based upon its physical constitution that is physical and mental makeup of that patient or the person, then his temperament and behavior. Temperament and behavior is very important in dealing such type of cases, because every child has his own reaction towards the adenoids. Okay, so then what are his reaction to that fever or to that snoring or to that various types of clinical symptoms in which the child is suffering from. Then after that, we consider modalities, aggravating factor as well as ameliorating factor. Then what are its associated complaints? Like what child is suffering from along with adenoids, what type of other symptoms he or she is suffering from. Then the aim of this treatment is to strengthen the immune system and to reduce reoccurrence of infections. Homeopathy offers improvement in the immunity of that child, and also it prevents the recurrent infections, and it is also helpful to avoid surgical intervention. But in very advanced cases, we have to go for surgery. But we can reduce the rate of surgery in case of adenoids by giving our homeopathic medicines. Homeopathy offers holistic and constitutional treatment in case of adenoid hypertrophy. So during during the homeopathic case taking, we have to consider child as a whole, not his hypertrophied adenoids. So we have to individualize the child on its physical symptoms, general symptoms, mental symptoms, and constitutional symptoms. For example, fair, fat, flabby, and sweaty child, we have to give our medicine like calcarea carb, or think of calcarea carb. Then, if the baby is shy, timid, with enlarged gland, we have to think about Baraita carb. So, in this way, we have to form the totality of symptoms, which includes local symptoms, nasal obstruction, mouth breathing, snoring, recurrent cold and cough, and general symptoms like appetite, perspiration, sleep pattern, thermal reactions, and we have to consider also the mental symptoms like fearlessness, irritability, shyness, or other symptoms. Then, after forming a totality, we have to also enlist about what miasm is at the root cause of these adenoids. If it is SORA, then child is suffering from various recurrent type of infections. Then, if the miasm is psychotic, then there is severe glandular enlargement, and all the nasal discharges, they are very much thick. Then in tubercular diathesis the child is suffering from various types of ear infection or various types of respiratory infections. So the remedies like tuberculinum are also indicated in such type of cases. The aim of this homeopathic treatment is to reduce the attack of adenoids, or especially when the child is suffering from severe attacks of tonsillitis or adenoids. We can if we are giving our homeopathic medicines for this adenoids, the attack rate, or that we can tackle that symptoms the child is suffering from that adenoids. When we are using the repertory in case of adenoids, we can collect the rubrics like nose adenoid enlargement, nose obstruction adenoids, then nose breathing through the mouth. Then when the throat is enlarged, we can give tonsils enlarged. Then in the ear, we can use the deafness in space, especially in case of adenoids. Then sleep is very much disturbed in case of adenoids. So we can use the rubrics for like snoring, sleep disturbed, snoring. Okay. Then after repertorization, there are various remedies which come put forward. They are like Baraita carb, calcarea carb, tuberculinum, thuja, silicea, and morsol. And when we want to differentiate tonsillitis along with adenoids, then what type of symptoms we should consider in the totality? First and foremost, tonsillitis refers to the inflammation of pharyngeal tonsils. The inflammation may involve other areas of back and throat, including adenoids and lingual tonsils. Tonsils are the first line of defense immune system against the bacteria and viruses that may enter the mouth. Viral or bacterial infections and immunological factors lead to tonsillitis and its complications. Which type of viruses they can tonsillitis? Like adenovirus, influenza virus, Epstein-Barr virus, parainfluenza viruses, enteroviruses, and herpes simplex virus. Streptococcus species are common bacterial cause of tonsillitis. Tonsillitis are caused by bacteria Streptococcus species, typically occurs in the children 5 to 12 age group, which is most commonly seen in younger children. Then there are various differential diagnoses we can make with tonsillitis as well as adenoids. They are, first is acute tonsillitis, then peritonsillar abscess, that is quinsy. Then second is chronic tonsillitis, and the fourth one is recurrent tonsillitis. Okay, if we want to differentiate all of this, then we can differentiate in this manner. In acute tonsillitis, symptom usually resolve in 3 to 4 days. Okay, but it may last for up to 2 weeks in spite of giving proper medication. The child is suffering from severe fever, sore throat, foul breath, dysphagia, that is difficulty in swallowing, then odontophagia, painful swallowing, tender cervical lymph nodes, airway obstruction due to swollen tonsil, and it may cause mouth breathing, snoring, and nocturnal enuresis, or sometimes nocturnal breathing pauses, or sleep apnea. Child also suffer from severe lethargy, malaise, hoarseness of voice, loss of voice, headache, loss of appetite, ear pain. And in young children, the signs of tonsillitis may include doubling of saliva due to difficult or painful swallowing. There is refusal to eat and irritability. These are the various signs and symptoms when the child is suffering from severe acute tonsillitis. We are differentiating acute tonsillitis, chronic tonsillitis, peritonsillar abscess, that is quinsy, and recurrent tonsillitis, and our adenoids. So what happens in peritonsillar abscess? There is severe throat pain, fever, dribbling of saliva, foul breath, trismus, and muffled and hot potato voice. And in recurrent tonsillitis, this diagnosis is made when the individual has multiple episodes of acute tonsillitis in a year. Individuals often have chronic sore throat, halitosis, tonsillitis, and persistently tender and cervical node. This is most commonly seen in chronic tonsillitis. This is a clinical presentation with the all differentiated diagnosis like acute tonsillitis, chronic tonsillitis, peritonsillar abscess, that is quinsy, and recurrent tonsillitis. Then we will move on exactly the clinical sign. This is clinical signs of tonsillitis. We can make out tonsils. They are visibly red and swollen. There are patches of white discharges of infected tonsils. Okay. These are red swollen tonsil with severe congestion in the throat. Patient or the child is suffering from severe fever, enlarged and inflamed tonsils which are covered with pus. Then there is tender cervical lymph nodes and neck stiffness. There is also unilateral bulging above and on the sides of one of the tonsils with peritonsillar abscess, that is quinsy, which exists. There is also a stiff jaw, difficulty in opening the mouth, and pain referred to ear, which may be present in various severity. See, these are the clinical signs: swollen uvula with whitish spot, red swollen tonsils, throat enlargement or throat redness, and red swollen tonsils. So if we want to differentiate with adenoids, we can differentiate it in the next slide. That is, adenoids, these are nasopharyngeal tonsil when they are hypertrophied in response to viral, bacterial, or allergic stimuli. These are the main causes of adenoids. I will again repeat: viral, bacterial, or any allergic stimuli. They are produced symptoms called adenoids. The symptoms leads to the symptoms of nasal obstruction such as mouth breathing, noisy breathing, nasal tone of voice, persistent nasal discharge, deafness due to obstruction of eustachian tube, and typical facial appearance called adenoid faces with elongation of face and open mouths, slack jaw, and prominent eyes. Okay, these are the most important symptoms we are seeing in our day-to-day practice. The patient or the child, they come with the same chief complaint of mouth breathing, noisy breathing, nasal tone of voice, persistent nasal discharge, and child is suffering from various types of respiratory disorders, or his immunity is drastically reduced due to the severe attacks of these adenoids. The inflammation of adenoids may cause persistent nasal discharge, post-nasal drip, and sometimes it may cause acute otitis media. This is the pure clinical presentation of adenoids. You can also make out from this picture, this is a nasopharynx and these are the enlarged or hypertrophied adenoids. Okay. Then what type of investigations you go for when the child is suffering from severe adenoids? First, we have to take a proper clinical history, and if we want to give our homeopathic medicine, we have to take a proper acute totality as well as chronic totality, which is purely based upon physical symptoms, mental symptom, constitutional, temperament, diathesis, and whatever. Then along with this, we have to go for throat swab and then culture for streptococci, then X-ray of nasopharynx, which is also helpful in determining the size and shape of adenoids. Then also we have to go for blood tests like CBC for diagnostic the infections such as infectious mononucleosis and other types of infection. Then sleep study. Then we have to evaluate the sleep disturbance or sleep apnea due to the enlarged tonsils or adenoids. Sometimes due to mouth breathing or repeated infection, the child is suffering from various sleep disorder. So we have to rule out what is his sleep pattern or what are the various disorders which are related to the sleep. These are the basic investigations we go for if the child is suffering from adenoids. Then what type of conventional treatment we go for tonsillitis or adenoids? Then medications like adenotonsillitis resulting from streptococcal infection is usually treated with antibiotics. This is a modern way of medicine or allopathic mode of treatment we generally go for when the child is suffering from tonsillitis or adenoids. Adenoid tonsillitis resulting from streptococcal infection, usually treated with antibiotics. Unfortunately, there is currently no medication for viruses that may cause tonsillitis. And sometimes when the child is suffering from repeated attacks of these adenoids or tonsillitis, in general, the patient may candidate for tonsillectomy, or if or she needs to one of the following criteria, like when there is 7 or more episode of tonsillitis in a year. Okay, sometimes the child is suffering from severe attack of tonsillitis as well as adenoids in a 1 year, or sometimes there are 5 or more episode of tonsillitis in each year over a period of 2 years. Then sometimes 3 or more episode of tonsillitis in a year for a period of at least 3 years. Then tonsillitis that reoccurs despite of treatment with antibiotics. Then airway or swallowing obstruction due to swollen tonsil. Surgery is often advised arbitrarily even to the patient not meeting the criteria. But surgery is not the last option. We can give our homeopathic medicine for boosting the child's immunity, and we can definitely avoid the attacks of tonsillitis as well as adenoids when the child is repeatedly suffering from adenoids. We can also reduce the rate of infection. We can also reduce ear pain. Okay. Then if we want to go for proper homeopathic medicine or constitutional homeopathic approach towards a case of adenoids, we have to first clinically classify the disease. Okay, whether it is a surgical disease or whether it is a dynamic disease. Surgical disease, it means local malady due to when the cause is external. And in the dynamic disease, we have to again categorize it acute disease as well as chronic disease. Acute disease means sudden onset, rapid progress, and in the chronic disease, we have to again categorize it disease with fully developed symptoms and one-sided diseases. One-sided disease, they again classified into having external, internal complaints as well as local diseases. In the local diseases, they are again classified when there is causes, external cause and internal cause. This is a proper clinical approach or homeopathic approach towards a case of adenoids. We have to take a proper homeopathic case taking. Then we have to go for his mentals. What is his reaction towards the each and every symptoms? What is his mental, especially during the acute phase, or with what is his reaction, especially during his chronic phase? Chronic phase means when the adenoids attack is tackled with homeopathic medicines. So this is approach towards the management of tonsillitis as well as adenoids. First, step 1, step 2, step 3, and step 4. In the step 1, we have to ascertain the complete picture of disease by proper case taking. In homeopathy, we have to consider patient or the child as a whole. So our totality is purely based upon the what type of symptom the child is suffering from. Okay, so we have to form the portrait of a disease. Then second, selection of homeopathic remedy corresponding to the totality, acute totality as well as chronic totality. Okay. Then in the step 3, we have to take a acute totality, which is purely based upon acute symptoms. Acute totality is to be tackled first in case of acute affection or acute attack. And after the acute attack is over, if we want to completely complete cure, we have to give the anti-miasmatic treatment that is purely based upon miasms. What SORA, syphilis, psychosis, and tuberculosis. What is the basic miasm of that patient or that child? So we want to give our medicine which is anti-miasmatic treatment once the acute state has been subsided to prevent the recurrence and chronicity. After giving anti-miasmatic treatment, there are 100% chances of getting complete cure. That is purely based upon homeopathic way of treatment or homeopathic way of medication. Then after the homeopathic repertorization and homeopathic case taking, there are some 5 marks remedy which put forward, that is homeopathic therapeutics for tonsillitis as well as adenoids. First is Agaricus nutans. In this condition, there is enlarged tonsils with throat and ear troubles, and the patient is suffering from repeated attack of adenoids. Then second and most important remedy is Baraita. When the child is very much timid, shy, and there is chronic tendency of swollen tonsils which tend to separate from every cold. Okay. When there is a severe attack of cold, the child repeatedly suffering from cold, coryza, and the same cycle, same vicious cycle is going on and on. Okay, then there is severe pain which is worse by empty swallowing, solid foods, or thinking of the elements, can only swallow liquids. These are scrofulous children who are backward mentally as well as physically. So Baraita carb is very wonderful remedy which is given in case of tonsillitis as well as adenoids. Then the third important remedy is belladonna. In this, there is acute tonsillitis with sudden and violent onset. Okay, belladonna is always used in acute phase of adenoids when there is the pace of disease is very small or when the attack is sudden and onset. So it is always used in acute tonsillitis with sudden and violent onset. Elements from exposure to dry cold wind. Tonsils, they are very bright, red, with throbbing pain and sensation of heat. Paroxysms of pain appear and disappear suddenly. Patient is restless, sensitive, and nervous. Tonsils are red, worse especially at right side. Tonsil feels constricted, difficulty in degradation, and the all liquids are very painful to swallow. Okay, so belladonna is very important remedy after Baraita carb, which is most commonly used in case of acute tonsillitis as well as chronic tonsillitis along with adenoids. Then the four important remedy is calcarea carb, which is prepared from middle layer of oyster shell. In this condition, there is severe swelling of tonsils and submaxillary glands, usually indicated in chronic tonsillitis for the children who takes cold easily. All the calcareas, they are fair, fat, flabby children with large head and open fontanelles, with having profuse sweat and distended abdomen. They are very much slow, sluggish, shy, and get tired easily. Okay, these are the various symptoms of calcarea gall. Then calcarea pos. Calcarea sulf and calcarea fos. Calcarea sulf, this is a good remedy for glandular swelling, especially tendency to suppuration. Then there is pus in the tonsils as well as adenoids with thick yellow and bloody discharge. It differs from hepar sulf in the sensitiveness to the air. Hepar sulf cannot bear slightest exposure, but calcarea sulf is better especially in open air, better in walking in it, and desire for it. Both are worse from change of weather, but calcarea sulf does not have excessive sensitiveness to touch, which is found in hepar sulf. Usually, we give either 30 potency or sometimes in a 200 potency. Then carbolicum acidum. This is also next very important remedy. In this condition, there is severe burning in mouth. Then uvula is whitened, shriveled, and putrid discharge, almost impossible to swallow. When we give it in a 30 potency, repeatedly it works like a homeopathic antibiotic. That is carbolicum acidum. Then there are various remedies like hepar sulf, throat extremely sensitive to cold to touch, Vinci, that is peritonsillar abscess with impending suppuration. There is severe sensation of splinter or fish bone or plug in the throat, which is aggravated better in the warm air. There is also sensation of plug in the throat. There is chronic hypertrophy of tonsils. Then next, it's calimuraticum. Especially it is used in follicular tonsillitis, as well as there is grayish patches or spots into the throat and tonsils. Then again, next important remedy is lachesis. Lachesis, well, along with this carbolicum acidum, calcarea sulf, then eucalyptus, mother tincture, ferrum pos, these are also very well indicated remedy, which are also always useful in case of tonsillitis, tonsils which are red, swollen, ulcerated, sore throat, and when there is eustachian tube is inflamed. The next remedy is Merxol. Merxol is used in advanced state when there is suppuration, sensitive to both heat as well as cold. Tongue is flabby with imprints of teeth. There is profuse salivation and profuse offensive perspiration. Patient has a constant desire to swallow. There is putrid sore throat, which is specially aggravated on a right side. Then sorinum, it is also good remedy which is useful especially in case of chronic tonsillitis. In this condition, the patient is extremely chilly patient. Elements from every draft of cold air and warm, profuse offensive saliva and carrion-like water. Then the next remedy is Staphy's agria. In Staphy's agria, there is stitches of flying to the air on swallowing, especially on left side. Then Tarantula is also good remedy. Tarantula cubensis, tuberculinum. These are very, very, very important remedy which are used specially in case of adenoids. Then after discussing various remedies which are specially used in case of adenoids, now we can also we can also tackle the attack of adenoids, especially by using general measures like gurgles in the warm water with 1 cup of which teaspoon of salt which has been added, and repeat this twice in a day or more frequently if required. Then we can also recommend to take a ginger juice which is mixed with honey. Then gargling with warm water mixed with salt and turmeric powder, also very much effective. Then drinking plenty of warm fluids, ginger tea, they are also good for the soothing effect of adenoids. Then we have to tell that child or the patient avoid spicy foods, then smoking and acidic drinks, then suck on throat, then make a drink by mixing honey or a lemon juice in a warm water. Sip it often to soothe the throat and to reduce the mucus production. Then, along with this, proper rest and sleep is very important, which will helpful for the child for the better recovery. Then, along with this, adequate fluid, which must be taken to keep the throat moist and to prevent dehydration. Irritants like cigarette smoke and cleaning product that can irritate the throat is completely avoided. Okay, so these are the general measures we generally use to especially in case of when there is acute attack of adenoids or tonsillitis. Our homeopathic medicine, they act like a miracle when we given them in a proper dose or proper potency, and we have to take a proper follow of that patient or that child. Then after completing this homeopathic management of tonsillitis, we have to I have made a proper case taking format of this tonsillitis or adenoids or adenotonsillitis. We have to take first clinical symptoms like nasal obstruction, mouth breathing, snoring, and recurrent cough and cold. Along with this, what are the various symptoms like associated symptoms, ear pain, nasal discharge, and what type of sleep disturbance? Then, along with this, what type of physical generals like appetite, thirst, sweating, and thermals? Then, in mental general, we have to consider about what is the behavior of child. That is, whether he is fearful or fearless, or whether he is irritable or not irritable. And then, along with this, we have to consider what are his family history, like tuberculosis, allergies, and various types of respiratory disorder. And next, and we have to consider next slide. Now, this is tonsillitis and enlargement of adenoids, especially in case of children. Okay, these are tonsillitis, and these are the we can make out from this picture. The child in this condition, child is suffering from severe tonsillitis, and in this condition, we can see the exact look or the clinical presentation of that child which is suffering from adenoids. In these conditions, child usually keeps his mouth open. We can see from this picture, child usually keeps his mouth open due to difficulty in breathing as well as through nose. Noisy breathing, sleep is disturbed, snoring, nose becomes wet with discharge, altered voice, obstruction in the nasal obstruction, maybe severe pain in his ears. So in these are the clinical presentation. I will again repeat, child is repeatedly suffering from various breathing disorders, snoring, mouth breathing, see his nostrils, see his open mouth. He always sleep in this pattern only. So in this condition, what can homeopathy can do? After taking a proper clinical history, we form a totality and give our homeopathic medicine, which is purely based upon totality of symptoms. We have to first form the portrait of a disease, take his mentals, take his physical generals, take his mental generals with will, emotion, and intellect, then take his thermals, then take a proper clinical totality and give the medicines. And the medicine will act like a miracle. When the child is suffering from severe obstruction at the root of the nose due to enlarged adenoids, child breathes with the mouth, then he is prone to various types of infection. He is prone to suffer from repeated frequent cold and cough, and there is diminished hearing. We can give our homeopathic medicine. Then when in the second condition, when all the discharges they are thick, sticky, yellowish, with nasal discharges from back of the nose into the throat, frequent desire to blow the nose and diminish hearing. we can give hydrolysis in a 30 potency. Then when in the third condition or when in the third case, when the patient is or the child is very pale, anemic, weak, children who are very irritable, who get irritable easily, child has frequent cold extremities, there is weak digestion, and the child vomits frequently, and sometimes there is impaired hearing. We can give our medicine like Scalcaria phos. Okay, these are the various symptoms in which we can give the homeopathic medicine. See, this is enlargement of adenoids. These are the hypertrophied adenoids which are specially situated into the posterior wall of nasopharynx. So adenoids are the pieces of soft tissues or the glands which are present in the back of nose and throat, and they are not visible directly from outside. Adenoids get very clinically infected, and due to the causes like infections, either bacterial or viral, allergic type of symptoms, then various signs and symptoms like blocked nose. So this is a clinical presentation of tonsillitis as well as adenoids. Our homeopathic medicines, really they act like a miracle when we give them in a proper dose or in a proper potency. They act like a wonder. I think this is more than enough for today's presentation. Hello?
Yes, yes. Dr. Seda. Yes, Dr. Amruta.
Thank you, sir.
It's really a very good session, even though we have a static problem due to.
Yes, sir. So extremely sorry for that inconvenience.
Yes, no problem. This can happen because these are things happens.
Yes,
Maybe
sir.
we are sitting in different part where
Yes,
that talking, and at times these things can happen. Don't worry about that.
yes, sir. It's what I really thankful for the IPH forum that it has given me this wonderful platform to say a few words regarding adenoids as well as tonsillitis. It's a great pleasure for me that I am able to present this webinar in front of you. It's a great pleasure for me, really.
Yes, exactly. That we are also thankful because we are conducting the Zoom every day and we are uploading the videos every day. Unfortunately, even your students are not watching this problem. But you
Yes, sir.
kindly share the videos and ask them to subscribe because there is no specific charge for it. It is absolutely free.
Yes, sir.
Just like you, people are coming over here and delivering your speech without taking any penny because that's because of your love for homeopathy.
Yes, sir.
And,
Definitely.
that's why we would like to have more subscriptions from our homeopathic lovers as well as homeopathic doctors.
Yes, sir. Sure, sir.
What, what is the present condition in your city, homeopathy? What is the
Uh, actually, there is lot of awareness nowadays. Lots of people they are coming to take a medicine, especially in case of adenoids as well as tonsillitis. Because in modern medicine, there is very limited role of medicine. What happens after giving one antibiotic, the patient feels better for some time. Then they again come with more advanced symptoms, or the disease more goes into the deeper level. So in that cases, if we can able to prescribe them our homeopathic medicine, they really act like a miracle, and we can
okay?
tackle that acute attack as well as.
Okay, okay. Kindly open your video also. Dr. Amresh sir, you can say what are thanks to the session, and then
Thank,
Sweta will conclude the session.
thank you,
Thank you.
Dr.
Thank
Dhanesh
you,
ji,
sir.
and congratulations,
Thank you,
Dr.
sir.
Amrita Anand. Very good name,
Thank you,
Amrita
sir. Thank you so
Anand.
much.
Happiness, joy, and a spiritual bliss. And describe the adenoid
Yes, sir.
tonsillitis. Very good. Describe lot of medicine.
Yes, sir.
Lot of medicine. So, Agarifus Newtons,
Yes, sir.
adenoid patient background, family
Yes.
history, suffering from tuberculosis.
Yes, sir.
तो agarifas nutans is a very good remedy
Yes, sir.
enlargement tonsil, लेकिन adenoid with deafness
Okay.
adenoid
Okay.
तो very very thanks
Thank you,
Dr.
sir.
Amrita behalf of IFPH.
Thank you, sir.
Very, very thanks again presentation. And Namaskar, Dr. Venu Gopal, sir. Namaskar. Thank you very, very again presentation.
Okay, sir.
IFPH whole team.
Okay, sir.
Thank you.
Thank you, doctor. Thank you all.
Thank you. Thank you, ma'am.
Thank you for your beautiful session, Dr. Amrita. Even with some technical problems, you delivered your presentation in a very good manner. Thank you, doctor.
Thank you,
Thank you
ma'am.
all. And let's wind up the session. And I'm handing over the session to the next doctor.
Okay.
Thank you all.
Thank you, Dr. Seda. Tomorrow we'll have a session from Dr. Mini Mehta from Delhi, and Dr. will be talking about gout and homeopathic management.